George, thanks for being with us today.
Hello, Dave, and thanks for having me.
Now, you're currently developing a COVID-19 test. What can you tell us about the test? You did put out a release a couple months ago. What are the next steps in the development process?
Well, the test has been developed, and currently we're going through the technical validation. We're validating the test on 3 different bits of equipment. This will allow us to scale up with multiple labs. This week we'll be using next-generation sequencing to validate the test. Last week was open array, and so on. So we expect this process to be completed shortly. And once the regulators certify us, we'll be able to release the test to the market. With luck, it'll be this side of Christmas.
George, let's dumb this down a little bit. You're using next-generation sequencing. Explain that.
Yes, until now, we've worked with open arrays, which is a very robust way of detecting risk through our test. We're moving to a more sophisticated process called NGS. This is equipment that is available in a lot of different laboratories. So what it means is that it'll allow us to have relationships with more pathology groups using this technology. By the way, this is a very accurate, low-cost method of assessing risk.
So just so we're clear, you're getting data from those who have had COVID-19. You're looking at their genetic profile and then determining who would be susceptible to this disease based on their genetic profile?
Correct. So until now, the only thing that we've had to assess risk has been clinical risk models, which look at your age, body weight, and comorbidities. By adding a genetic risk score or looking at your DNA, we are able to increase our ability to detect someone with risk by up to 111%. So this is a very powerful additional tool in the COVID fight. It allows us to identify people at risk, and the whole story has been who is at risk and who will require hospitalization. And this is why we've been so hard on isolating and shutting down, because we haven't had an accurate model for assessing these individuals, and now it's about to hit the streets here.
Talk to us about the path to commercialization and how you will market this test.
So we are uniquely positioned, especially here in Australia. We are certified both for the American market and the Australian market with the respective regulators, NATA in Australia and CLIA in the United States. This will allow us to sell our tests into those markets once the regulators have certified the technology. This is a process which is similar to our other tests. We've already been in touch with the regulators, and they are aware of what we're doing, and hopefully the process will not be complicated. The discussions we've had talked about a shortened path to market due to COVID. So we're hoping this will continue.
What is the best and worst case in terms of the timeline for approval and commercialization?
Best case this side of Christmas, and worst case it'll be just a little bit on the other side of Christmas. So it's a question of weeks, not months.
Now, George, as you've mentioned, you've already launched risk tests for breast cancer and colorectal cancers. How are you bringing these innovative tests to market?
Well, strangely enough, we released these tests just when COVID hit the streets. So we had 1 good month in the clinics. In that time, we were able to identify high-risk groups, which resulted in their management being changed. This was a very positive introduction of our technology, and it resonated very well with the doctors. In recognition with the limitations around COVID, seeing doctors and people being available for tests outside of the current pandemic, we have developed a consumer-initiated testing platform. This is an online platform both here in Australia and in the United States. This platform will allow us to introduce our product to the community seamlessly without having to overcome the COVID restrictions directly. This also means an introduction of our technology to a whole lot of medical practitioners And this will be done through a training program. In Australia, this is mandated by the College of General Practitioners, and we'll be trying to reproduce that same program in the United States. An online opportunity for us is fantastic because it's difficult to match resources with large players. We're using traditional methods. So an online approach using social media, brand ambassadors, is something that will allow us to penetrate the market, we feel, at a reasonable price point.
George, what makes your technology better or different, particularly your breast cancer test?
The breast cancer tests or the genetic breast cancer tests that are currently known to the market are around inherited mutations. We often refer to these as a BRCA panel test. These are relevant for 1 in 400 women, and they impact in at least 5 or 10% of breast cancers. Our test is relevant for the other 90% of breast cancers, where there's no family history or necessarily no family history, where there are relatively few clues as to this person's susceptibility. I might add, Dave, that traditionally we've been looking at this group, the larger group, the 90% of breast cancers, but we are introducing tests now to cover all breast cancers. So we'll be looking at the inherited and the non-inherited. So we'll be a one-stop shop for 100% risk. And this is something which is being implemented at the same time as our COVID tests are being certified.
Now, you recently raised capital. What's your cash position look like? Or do you have the funds necessary to move forward on the commercialization of these tests?
Yes, we've got 2 years of money in the bank, and that has allowed us to make some very dramatic changes at Genetic Technologies. We've beefed up our scientific team. As an example, we were able to create the COVID product in 3 months, whereas previously it had taken us years to develop tests. This is especially true when we were collaborating with universities and institutes and relied on their scientific input. Now we've got, as I said, a crack team of scientists, and as you will see shortly, we'll be able to create numerous tests in 3, 4, maybe 5 months per test, or should I say it the other way, 5 for maybe 3 months per test. And our tests are not just genetic tests. We always include clinical risks where appropriate, and that gives us a very powerful tool. So we've got money for the scientific team. We've got money for the online sales process. We're heavily investing in education, and we're looking for other opportunities in our space technology, which doesn't necessarily cover the diseases that we cover, but technology that is useful and is able to be integrated into what we do. So just to remind you, we've got breast and colorectal cancer in the marketplace, but we've completed work on type 2 diabetes and heart disease. When I say heart disease, I mean ischemic heart disease, the #1 killer, and rhythm disorder, atrial fibrillation. And we're working on melanoma and prostate and COVID. So these are all going to be in the marketplace shortly.
Excellent. Well, that sort of sums up the value proposition, I think, for Genetic Technologies. Any closing statements for investors today, George?
I think that the importance of the work that we do is being universally recognized now. They describe 2019 as the tipping point for genetic testing, and I would have to wholly agree with it. I think our tests are better and more accurate. The price point is much lower, and our ability to include new tests is now being proven. So as a value proposition, we have solutions for the biggest challenges in modern medicine. We do it painlessly, without drug interactions, and we do it at a good price point. So I think that we're worth looking at. And as I said, COVID is an additional challenge, and we've proven that genetics is not necessarily only for common complex diseases. It can be used in just about any process as well as pandemics.
George, wonderful story. Thank you so much for being with us today.
Thanks for having me, Dave.